As you know, we come to you every Wednesday at 6:30, live from TBN Studios. We apologize for the late start this evening. Sometimes to put something together really good, it takes a little bit of time. So tonight we are going to go through with what we started with last week, but before that we just want to say happy holidays to you from Innovative Dentistry and from Innovative Dental Care. Your trusted dentist is Dr. Pico, and he's here with me tonight. Dr. Pico, welcome to the show.
Thank you so much, sir. I'm pleased to be here.
How has the holiday been treating you?
So far, so good, sir.
Things been at the clinic?
Quite busy these days.
Lovely. You know, what has been your... Okay, so you're originally from Cuba. And obviously the way things are in Guyana and the holidays here in Guyana, especially Christmas, how different is it?
Actually, it's not so much different because Guyanese are spending holidays in family, things like Cuban, because this is a family season, so it's the same, almost the same, just different type of food. But in the essence of the holidays is the same for Guyana and Cuba.
I'm sorry, but now that the holidays are on and it's on to us, what's the... Christmas is all about food and drinks and lots of sweet, chocolate and all of that. What... There will be some implications having all of this and so on. You have to take care of your teeth, you have to be brushing extra, I guess. But there will be, you know, more than likely, if you don't take care of it, you're going to end up with cavities, and I think that's what you want to talk about tonight, right?
Exactly. It's not, well, the holiday season is not dangerous for those people that are taking care of their mouth the whole year. The people that are having holidays every single day of their life during the whole year, they will be in trouble because you have to be taking care of your mouth the whole year. So if you spend the whole year having bad a bad diet, like eating and drinking sweets and so, then you will end up in troubles if you don't take care of that situation as early as possible.
Okay. Tell me, okay, let's break this down. What causes cavities? In the best way you can tell us, what causes cavities?
Okay. As I explained in our last program, the cavities are caused by the consumption of a diet high in carbohydrates that are not being removed from the teeth in a proper manner. So if you are having this type of diet full of carbohydrates and sweets, and if you are not able to remove that dental plaque that these carbohydrates will produce, then you will end up getting cavities or gingivitis or periodontal disease.
Okay.
Because we have in our mouth some bacteria those carbohydrates will feed those bacteria, the bacteria will grow, and then those bacteria will produce some acid that will damage the enamel, and also some chemicals that will damage the gum.
Different types of cavities. So I have the first image here to show what this one here.
Okay. So cavities are starting in certain surfaces that are not immune to cavities. Like for example, in this image, you see the occlusal surface. Occlusal surface is the masticatory surface of the molars. This particularly you can see bicuspid here. The second upper bicuspid. So that little point that is possible for our audience to see.
The-
It's a deep pit and fissure. So when we as a dentist, when we are in the middle of the examination and we'll take the explorer, we can find out that there is a deep fissure there,
Yes.
which is also that we can see also discoloration, a change of the color. The tooth is no longer white, glossy, will change into a black little point. Then, as you can see here in the second picture, after opening the cavity, opening the fissure, you will notice that that small little point is hiding a huge cavity underneath. That, which is the previous image. Please go back to the last one, please.
The first one? The one before?
That one, yes. You see that little point that we were showing before? Once we open under local anesthesia, then we can see a huge cavity hiding underneath that little point. So we will go and continue cleaning, so you can that is the cavity after cleaning all that dark area that was showing. That dark area is dentin that is infected by bacteria. And then once we clean the surface like this, the tooth is ready to get the filling over.
Okay.
Dental filling.
All
which
right.
is the next image that you can show there.
Before we go to the next image, I just want to say, guys, wherever you're joining us from tonight, again, welcome to this program, and just send us a message. You know, if you want to ask Dr. Pico a question, he's here. He's going to answer those questions. Let us know what you like to ask him. If you send a message and tell us where you're watching us from, we'll say hi to you. Perhaps send out some holiday greetings to you also. So what I got here is that a very small cavity can occur, and you can deal with it immediately.
Exactly.
But over a period of time, what we're looking at here is that it keeps deteriorating, and at how rapid a rate, or what determines how rapid a rate your decay can go?
That is a good question. It is important for our audience to understand that one thing, that the cavity decay is a multifactorial disease. So it's not only one factor that will be the cause of these cavities. You will need to have the junction of so many factors, like for example a low immunity, a diet. It is important, I am repeating all the time about the diet. A diet high in carbohydrates, high in sweet things is very dangerous, because you are feeding the bacteria that are normally living in our mouth. But also an enamel that is not properly formed can not be resistant enough to cavities. Also, as I say, the immunity of the person. Okay, if the saliva of that person don't have some kind of chemicals that the white cell produce to keep under control the bacteria, then that person will be very susceptible to get cavities. Okay, so you have to take care of all this factor. Also, as I say, since the very first program, we need to know ourselves. We need to, if we are not able to go to the dentist regularly, at least at home, while we are brushing our teeth, we can just go and check if there is any dark spot in our teeth. The teeth has to be white, different type of a shade of white. Sometimes it's extremely white, sometimes it's white and yellow, but certainly no black. There is no, if you notice any black spot, brown spot, mostly on the occlusal surface. Occlusal surface is the chewing surface of the molar, for example. People will see, because it's easy to see, the bottom set of teeth. However, it will be difficult to see the upper teeth because we don't have dental mirrors in our home.
Indeed.
But if you notice any darkness on the masticatory surface of these molars, then you have to seek for attention because something is wrong there. Maybe it's a deep fissure that is not a cavity so far, but that is the beginning of a cavity decay. So if you get the attention before the cavity is already established, you will not end up paying, for example, for a filling which is more expensive than a sealant, for example. A sealant is a treatment that will seal that fissure. So by sealing the fissure, you are isolating the area from the rest of the mouth, so bacteria cannot grow in there or cause the damage. And if the dentist determines that deep fissure end up in a cavity, then the patient will receive a filling. However, as you show in the pictures, something that is looking teeny and small on the top of the chewing surface of the molars, however, underneath will be big. And why this happen? Because sometimes some patient complain, I reach to the doctor having a little dark spot, and the doctor end up opening a huge hole in my mouth, in my tooth. Some people complain like that, and the reason of that is that the structure of the enamel is facilitating for those bacteria to open a little hole on top of the surface. But however, under that little hole, which is a deep fissure, for example, you will have a huge hole underneath, full of food, hiding a huge cavity under that little fissure. So because the disposition of the enamel, I am trying to explain this for people to understand. The disposition of the enamel is facilitating for those bacteria to continue digging in the. I am just talking in terms that people can understand. I don't want to go to
medical terms.
Medical terms. Digging in that enamel, creating a huge hole underneath a little fissure. So that is why sometimes when you go, and also it is important to say that while the cavity is at the level of the enamel, there is no pain. You will not feel any pain. However, if that cavity reaches to the dentin, remember that the teeth has different type of tissues. You have the enamel on top, which is hard, and then dentin underneath, which is more soft. If the cavity reaches to the dentin, then the patient will start feeling pain. First of all, under certain circumstances, like for example, while the patient is drinking cold liquids or eating cold food, then later on, while the patient is having hot food, and so the pain will be increasing. And this is because the dentin is alive. There is some cells terminations that are transmitting that type of sensations, the high and low temperature, and even the pressure. So once you feel that type of pain in your tooth, then something is really wrong. You have to seek for attention, because if you still waiting because you don't like the dentist, because you are living far, because your work is not allowing you to take care of yourself, then that cavity will continue growing. Usually the patient will be on their painkillers. The painkillers are hiding the pain, extending the problem in time. And also the patient will avoid, for example, to chew in that specific tooth, so there is no pain, but however the cavity is still growing underneath. And once the cavity is taking time to damage the enamel, because the enamel is hard, however the dentin is more soft. Once the cavities, all these bacteria are reaching to the dentin, then the progression is faster. because the dentin is soft, it's not so hard as the enamel. And once you start feeling this type of pain, you have to get attention, because if you still um, extending the visit to your dentist, then everything will reach into the pulp. Once it's reached into the pulp, the nature of the pain will change, and it's this type of pain that is not even the painkillers can do nothing to you. The painkillers will work sometimes for a short period of time, and then later the pain will will start again, a very severe pain, and sometimes it's making people cry and so. And it's because everything reached into the pulp, what people commonly know as the nerve. Once reached into the nerve, then the treatment will be different to save the tooth. Everything will end up in a root canal, which is a more um, advanced type of treatment, and also more expensive treatment than a filling. And or some people will prefer sometimes not to keep the tooth, but to remove the tooth, which is not something that I advise, because
you need your teeth.
Because you need your teeth. If your eye is paining, you will not say,
Yeah,
doctor, take out my eye, or cut my finger because it's paining. So we need, in this point in time, in the development of the humanity, if you have a tooth that is having this type of troubles, you have to try to keep your teeth.
And you can save it.
And you can save it by doing a root canal. But first of all, you can save your teeth by getting frequent checkup, and by doing some prevention first, because the sealants and the fillings and the root canals all have different prices, and the sealants are far away cheaper than the fillings and far away cheaper than the root canal. So it's something that you can prevent by going into all these type of treatments, just by getting a frequent checkup with your nearest dentist.
Brilliant. Two things. Before we continue, I want to say good night to Alia Mohammed. I see you're watching. Shakira Bakos, and our good friend who's been joining us, I think, for the last 3 programs now, Arjun Jawahir. Thanks for tuning in. As I said, we're coming live from TBN Studios right here in Queenstown, Georgetown. It's wonderful here if you're joining us from the diaspora. It's beautiful outside in Guyana here. The main street is all dressed up. It looks like Christmas. It should look like Christmas in Ghana, how it should be, right? I have a question. And this is something that I experienced, and a lot of people experience, and they keep telling me this. Why is it when you have a bad tooth, nighttime, you can't sleep, this thing out to your whole night, you can't sleep, and all you're doing now, you're waiting for this dentist to open the next morning so you can go and get it out. By morning, this thing stops hurting, and then you go about your day not realizing that you're gonna meet up with a nightmare on Tooth Street tonight again. And why does that happen?
The explanation of that is because that is very true. Nighttime the pain is more intense than during the morning, and it's because when we are about to sleep, we change the position of our head to a position in which the blood flow will be more into the pulp of each of our teeth. So if you have one tooth which is having a huge cavity, this happens only with huge cavities, nothing with the small cavities. Remember that I say that once the cavity is at the level of the enamel is not alive, so you don't feel that. However, if the cavity is so big that is already damaging the pulp, that pulp is inflamed. So the pulp has nerve inside, and the pulp is inside of a tooth, which is a hard cover. So the inflammation cannot expand the tooth walls. So that is why it's very painful. And if you are going to lie down, then the blood flow into your head is going faster, creating more pain. So some people can say that the pain is a beating pain. As you feel that your heart is beating, the pain
Yeah, yeah, it's pulsing, it's pulsing.
It's a beating pain.
Yeah, yeah, yeah.
Because it's coming with
The blood flow.
the blood flow. So that is why. And if the damage in the nerve is so big, then not even the strong painkiller that you can find will do anything about that, because the nerve is already damaged.
Here. Not that I'm encouraging people to do what I did, but I can remember I had a bad toothache. I think it was maybe 10, 15 years, possibly longer. And this thing, in Ghana, we said this thing is hot bad. And pain, I can't deal with this pain. So I went to the fridge and I had it's Banco wine? Have you ever had Banco wine in Guyana?
Wine, yes, no.
Yeah, that was the go-to thing, right? And a bottle of Banco wine. And I drank this wine, possibly the whole bottle. Two things happened. The pain stopped and I slept like a baby that night. But I'm not encouraging people to do that. But the follow-up question to that is, why does alcohol help? Is it the alcohol goes into your blood, into your system and numbs the pain, or is it goes directly to the thing and numb that?
No, actually the alcohol is working directly in our nervous system at the level of the brain.
Mhm.
So that will like numb. Let's go to say that.
Yes.
The brain,
effects.
The pain and so on. Remember that from what we see in some movies, people use that during the First and Second War to drink vodka while they are doing amputations and so stuff like that, no? That we see.
Yeah.
And it's because the alcohol is having an effect to numb the brain a little bit.
Yeah. Now,
so that is why. But of course, in these times, we don't have to do that.
yeah.
Okay.
Again, let me say that we are not here advocating the use of alcohol, excessive use of alcohol, or alcohol in medical use at all, because there is everything available that you need for that right now. Medical.
Proper medical attention, yes.
Yeah. So we don't need for people to be, and then you drink a whole lot. When the police stop you, do a breathalyzer. It's like, well, I be watching this program, and the man say if you drink alcohol is numb the pain. No. We're not advocating that. What we are saying is that you must get to the hospital, because if you try these things, it will be a temporary thing, which might turn out to be worse anyway. Mm-hmm. Now, the reason I'm saying all of this is because these are the things that the ordinary man out there find ways and means to do. They find ways and means to do things. I've heard some very cruel things about back in the days what people used to do, and it may surprise you. I don't know if you've heard of this before, but I heard. Obviously, I've never seen it. But I've heard that people would hot a piece of metal and put it into the cavity to kill the nerve. Have you heard of that sort of thing?
That happens like in the ancient story.
Yeah.
When people to take care that there is no dentist at that period of time, so once you kill the nerve, there is no pain. Of course, that the process to kill the nerve without anesthesia that we use in these modern times, that will be extremely painful. But some people used to kill the nerve by using hot metal. Some people used to chew some kind of herbs, or to put inside some kind of salt. Like there is one which is very, very toxic. I cannot recall the name in English. Cyanide or something like that.
Cyanide?
Yes.
Oh wow.
Yes. That can even kill you.
Well,
but in those ancient times, people used to put those type of salt, because that can kill the nerve. But also by swallowing that, you can end up killing yourself. So all that type of thing, because something that is really true is that the toothache is one of the more severe pain that we humans can deal with.
Well, I'll tell you this. I've heard from several people, including women, who said to me that they say, and in Guyanese they say a baby pain is nothing compared to a toothache.
Exactly.
So
Because
now,
also sorry, let me remark something. This the audience can say when you have a tooth which is hurting, you will not be able to find or to locate which is the tooth. People say, okay, it's hurting me the bottom jaw, it's hurting me the top, and it's hurting me the ear, and half of my head and the neck. Everything is hurting me. So, and when we try to find which is the tooth, we are not able to find that tooth because at the beginning of an acute pain like that, since it's one nerve taking care of the innervation of half of your face, and in a early stage, then the pain will be like a refer pain that you cannot locate the pain. So that is why in an early stage of a pulpitis, which is the inflammation of the nerve, you cannot locate the pain really. While the pulp is getting more damage, then the pain will be more
severe.
Will be going down a little, but you can also say, okay, this is the tooth that is hurting me.
Oh, okay.
But in an early stage of the pulpitis, that I will repeat is the inflammation of the pulp, then the patient will not be able to say, okay, this is the tooth that is hurting me. The whole half of my mouth is hurting me, and it's because of that.
Great. We just want to say good night to a few people calling, messaging us here. Bansi Prasad. We have. So Azalea is saying that the process that we talked about, where they use this metal, it's called cauterizing the nerve. So cauterizing is when you use flames, hot objects, or so to
Exactly, yes.
cut an artery or something like that. So this is, it doesn't bleed, and also it's to cut that nerve.
Yeah, that is the modern and professional term to do that, but to do.
So Azalea, while we hear you with the cloves and so on, as I said, we're propagating that you go and get proper treatment from a qualified and certified dentist. So Dr. Pico, again, we're dealing with cavities, and we're looking at cavities because, as I said, the holidays are coming up. People are going to be eating a lot of different types of sweet food and all of that. It's natural, and we're not telling anybody not to eat because it's the holidays. Some people don't do it very often.
That is the people that are keeping the spirit of the season, but there are some people that are in holidays during the whole year. So
Okay.
those are the ones that has problems later on.
We see we're joined also here by Salomon Smith. Good night to you. Just let us know where you're watching us from also, yeah? So we can we'll give you some shout out from your neck of the woods too. A gentleman called me this morning, and I'm going off a little bit here because I wanted to get this over because I don't know if he's watching. Kevin has called me from Berbice this morning, and he said I should ask you a question. Kevin has a baby. He's just over a year, I think, or maybe not even a year as yet. I'm not sure the exact, but just about a year. And the baby has some white stuff under the tongue. Now, I haven't received a picture from him of it, but Kevin, if you're watching, you can send a picture to my WhatsApp, and we'll try to have a look at it. Are you what you think might be causing?
No, will be very important to see the picture, but also see the baby, because I will need to scrap the that white stain, and so to see if you can remove them, if there is bleeding after you remove the
white substances,
and so I will be able to assess what is going on there.
So your advice he should be taking for
better, yes, better than a picture. Is much better to
see the baby.
Yeah.
Kevin, if you're coming down to Georgetown anytime over the next few days, drop into Innovative Dental Care. The clinic is in Cummins Lodge on the railway embankment. It's if you're coming, because you'll be coming towards Georgetown, it's about 3 buildings before UG Road, and it will be on your left. You'll see a sign that says the Innovative Dental Care. Go there. Dr. Pico, Kevin is a good guy. He's my friend. I hope you don't charge him any money for consultation. We don't charge money for consultation, right? So Kevin, go there, and Dr. Pico is going to take care of that. I want to continue with this, with the pictures that we have here of cavities, because we would have gone off a little bit. Let me just bring up the next one, and so let's go back to this one here. So this is the tooth after cleaning out the cavity.
Once you remove all the black tissue inside of the cavity, which is infected dentin. So once that happens, then the tooth is ready to receive a filling, which is the next picture that you have there.
Okay, so let's go to that picture now.
Okay, so in this case, the tooth is receive a filling that as we can see is a very nice feeling, because you barely see that the tooth is filled with filling material.
Oh. And
so this is this case that the cavity didn't reach into the pulp, creating more damage. So in this case, the patient received a dental filling. In this case, particularly with zirconia composite, which is one of the best type of composites right now around the world, because it's really, really hard. And all these images are coming from my practice.
Right, that's the next thing I was going to mention. That if you bring up back on that on the screen, I just want to say that when you look at this, this image that you're looking at here right now, is the one that to the end, which has the silver. That is not that was not done by you.
No. That is the old-fashioned type of filling.
Right. So, and it's good that we have this picture to show the difference. And the tooth after the one with the silver filling is the one that you did.
Yes.
And that had a cavity. You filled it, and you cannot even recognize that there was a cavity there, because you use this.
A type of composite is the material that we use to fill the teeth. Composites are having some type of developments through all these years. Okay, so we have different type of composite, but particularly this one, which is a zirconia composite, meaning that zirconia is a very hard element that is coming now into the filling material. So this type of fillings are more hard than a regular type of filling. And also, as you can see, the beauty of the filling is also nice, because the way that the zirconia and the filling in general is reflecting the light is creating this appearance that the tooth is having nothing happened to the tooth. Because if you go back, you can see the huge hole, and after that, after applying this type of zirconia filling, you can see how nice the tooth is looking.
Indeed.
And this is the same case, another case with the interproximal cavity in an anterior tooth, in which the patient also decided to get a zirconia type of filling. So as you can see, the results are extremely nice.
And this is all work that was done by you.
All these images belongs to my practice.
Wow.
So now in this case here is the case that something that I was talking about earlier, about if you don't pay attention to those cavities in an early stage, then the cavity will grow, damage the enamel completely, reach into the dentin, and reach into the pulp, which is the case of this patient here. This patient, these anterior teeth were so damaged so deep that the cavities damaged the pulp. The pulp, remember when I say pulp, is what everybody knows as a nerve. So in this case, the patient has to go into a root canal, because the pulp, we cannot keep a pulp that is damaged. We need to remove that pulp, do a root canal, which is a treatment that will treat the whole tooth from the crown till the end of the root. And once everything is done, clean and in a proper way, then we will fill the tooth from the end of the root till the crown and build up back the tooth. And after the root canal is done, with the build up, we need to put over a crown, which is the next image that you have there. This is the same patient wearing later. These are zirconia crowns. I like zirconia, so that is why.
So you're saying, Dr. Pico, that this image here, and this is
These are
two teeth that got damaged, right?
actually three.
Three.
Where the arrow is, that is the lateral incisor, central incisor, and the next central incisor opposite.
Okay.
So you see all that blackness are cavities growing inside of those crowns, and some fractures also because of how big the cavities were. So in this case, we need to do root canals because the filling will not work. Once the nerve is damaged, and it's very important for our audience to understand that once the nerve is damaged, we cannot do just a filling because we need to treat that nerve. If you close a tooth with a damaged nerve, putting a filling over, then the bacteria that are inside will continue working and will create an abscess, a dental abscess.
Okay. So let me, and this next one here now, this is the
case.
The repair job
after it's completed, after the root canal was done with the build up, and these are zirconia crowns. As I said, I like zirconia. Zirconia is the latest material in dentistry now, so I try to bring that material into the country because it's strong, it's extremely strong, and also it's nice. As you can see, it's looking color is nice.
One of our viewers here, Azalia, she's saying that she's watching from the U.S. Virgin Islands, and she said that looks great. The color matches perfectly, and exactly that's what we're seeing here. So this is some pretty good work.
Something that I have to say is this type of work we do it digitally. So we scan the mouth of the patient, and we send that overseas. Then we will receive this type of with the code of the color, and as you can see, the work is nice and neat. The color is matching, and the margins of the crown, you cannot see any gap between the gum and the crown. That sometimes that happens, that there is a gap between the edge of the crown on top and the gum. So that is not a proper work. But in this case, as you can see, it's extremely well done. That is looking like nothing happened there.
And yeah, I mean, this looks amazing. How expensive are these procedures? Are they very expensive, or in your practice at your clinic, do you
actually this type of zirconia crowns are pretty expensive because we need to use overseas lab and so. But also there is the option of ceramic crowns, which is another type of treatment, which is less expensive because it's not so less type of
indeed
updated material.
Yeah. So you have
there are also acrylic crowns, which is less than ceramic crowns, so the price is less as well. But
so you have three ranges. Zirconia.
You can do for those people that cannot that has a limited budget for this type of treatment, but however it's something necessary because our anterior teeth. So you can do a build up with zirconia composite or an acrylic crown, for example, or a ceramic crown or zirconia crown or IMAX crown, which is another type of material, more nice because it's imitating the glass finish of the edge of the tooth. So we have all those treatments available in our office. So I cannot really disclose prices here because it's not ethical
No,
to mention
indeed,
that.
indeed, yes.
But I have options for everybody because I don't want to keep anybody nobody outside of to get a proper treatment.
And I know one thing for a fact. I mean, I've known you for a little while, and I know one thing for a fact is that everyone will receive the same professional treatment.
No matter the amount of that the person pay, will get a proper professional and painless attention.
Indeed. I want us to go through this here briefly, not too long because I don't want it to run, too much time to run out on our program time.
So I think that we already spoke about this.
Okay.
Because you know that we do this like a chat, so we don't really follow.
Right. So we would have.
So we talk about this, about how the cavities start as a white spot. Then that spot that you will notice that the tooth is not longer glossy, it's not shiny. Then will turn into brown. Then that is the meaning that the cavity is at the level of the enamel. Then when the cavity reach into the dentin, you will start feeling a pain that will be slightly, but if you continue denying yourself to go and check,
to get treatment
and seek attention, then that pain will be more severe, reach to the pulp, and if you continue not receiving the proper attention, then the pulp will turn into an abscess that will be acute first, then chronic, and then you can end up losing the tooth.
Which is number 6, and you're without teeth.
Without the tooth.
So you're basically like a baby again. No teeth in your mouth. You can't pepper pot. You can't. You have to go get dentures. The dentures is a pain, and
Exactly,
all of that.
yes.
So yes, I agree. You have to take care of your teeth. So, Dr. Pico, it's interesting having all of these conversations. Guyana is on the move, no doubt. We're on an upward trajectory. Everywhere you look, there is development happening. You can see people are energetic. They want. We know. We can see it. We can feel it that it's coming. We're on the launch pad and we've taken off already. How do you see dental care? And in 5 years from now, what do you think dental care would be like?
Actually, Guyanese, I can compare, since I have in Guyana 6 years now, I can compare the level of care. I can say that the level of care that I saw once I reached here, in comparing with how I am seeing that now, is totally different, because at the beginning when I started here, people were more into removing the teeth. They want to do an extraction, they don't want to know about root canals, they don't want to know about fillings. If you have a pain, they say, okay, remove the teeth, I will later put on a denture, or I will stay without the teeth, because anyway
You will still lose it.
yeah, exactly. So but now Guyanese are looking more like okay, I don't want to lose the tooth, or even Guyanese are asking for to get a whitening, okay, because the country is moving into a new era. So for you to get a job, a proper job, going into an interview will look nice if you show
Got a good smile.
a good smile,
Yeah.
and will not look nice if you have black teeth and missing teeth, and so you know. So people are more like into that type of things.
Well, everybody. I mean, everybody deserves a job, irrespective of what it is. But the appearance is what really matters, because it will give you points, right?
Exactly.
Yeah, it will give you points. I mean, you can't go to you can't go applying for a job as a receptionist and not have good teeth, I guess, because
Sometimes, as we can see, sometimes that smart people, they don't get the job because they don't look nice.
the appearance.
And the smile is part of that. And however, some other people that they don't are so smart and so they are getting it because they are looking, you know. And when they smile, you are showing nice teeth and so on, a fresh
Well, I guess some jobs are
smile and
made
so.
for some people, but again, as I said, I will stand up to say that look, people deserve job. But I get the point. I get your point to say
Yes,
that
yes,
listen,
yes, yes.
if I'm going to be standing at the front desk for a big business and
Exactly.
that's since somebody comes in there, it's a restaurant and I smile and there's one big rotten teeth in front of them. There's like, what if the receptionist like this or the person in front or a waitress like
How
this?
is it? Be-
What kind of food I eat in here? You know, like
Exactly. Yes,
yeah,
yes, yes.
it's a turn off. It's a turn off. So I get your point, but again, I'm saying that you know I believe in equal opportunities,
No, yeah,
and,
yeah,
and,
yeah,
and
but some is
but yes, I
what
get
you
the
say.
point.
Some type of work
Yeah,
jobs request a proper nice appearance. So the mouth that our teeth are part of that because we will not like for example I guess that during the COVID um, period people everybody has to use mask.
right. So
So
you can't see the teeth.
but now we are going back into a normality. So you have when you smile and when you express yourself and when you communicate yourself, the teeth are part of that.
Yeah,
With proper teeth, you can speak, you can have a proper speech, and also people can enjoy having a conversation with you because you are looking nice and so. So
yeah. And the reason I asked the question about where Ghana is going and how you see dental care in the future, because I just want people to know that this program that we're bringing to you here is not about Dr. Pico, it's not about his clinic, it's not about anybody's clinic. It's about telling you what needs to be done and how it can be done, and if it can be done to have proper care for your teeth and having interventions to done to prevent tooth loss. So that is what it's all about. As I said in the first show, if you can't go to Dr. Pico's clinic, you can go to any clinic, the closest one to you to get medical attention. We, what we are doing here, what myself and Dr. Pico is doing here, we want to spread this message about how easy it is to take care of your teeth or how difficult it can be if you don't do it
on time.
on time, because
Exactly.
it can be a very expensive procedure, might be waiting to happen if you want to save it.
As we repeat in every single program is that the prevention is the key. Prevention is
Better than cure.
better than cure.
Yes,
So that is the main message here.
brilliant. We are coming up close to program time. We got another 10 minutes or so. What is your message about? Okay, as I said, it's the holidays and all of that. What should be done? How you should take how?
As you have to just because it's holiday season, you cannot forget to brush your teeth uh, um, on time, at least 3 times a day, because actually it's four, but sometimes we can skip one of the brushing time, but you have to do it at least three times a day, and you have to keep flossing and using your mouthwash and you have to examine your own mouth in order for you to see if there is any changes and so. That is my message every single program that I am here.
Okay.
And you just enjoy the holidays, being responsible of your health care and also being responsible of your actions about your own health care and the people that are surrounding you and depends on you, like our kids and so.
Yeah, especially the kids, because what I know for a fact is that kids tend to receive a lot of chocolate and sweets. They eat a lot of cake. They drink a lot of soda, lots of sugary stuff. So if you're going to be giving your kids all of this during the holidays, please ensure that they brush their teeth. Because what's going to happen is that it's very irresponsible for us as parents to do that and not realizing, or perhaps realizing but being negligent to the fact that this child will go to bed tonight, and you and Kay, but in a few years, he or she's gonna lose all their teeth, and you know, by then you would have you like, well, I don't know, they probably didn't take care, but it has to start now. And for older people, although for adults also, you have to be responsible in taking care of your teeth and doing what is right. So that is why I asked you about the holiday season, because I know what happens. I know how it happens. Children everywhere, every family they visit, there's a bag of chocolate waiting for them there. They don't. They take those chocolate, they eat between themselves, and they're kids. It's a natural thing, so they have to enjoy themselves too. And sweet give us that happy feeling, as you said, releases dopamine and all of that. So it's a good thing. But again, we have as parents, you have to be insistent that these children take care of the teeth. They brush, and that they do this what is necessary to take care of the teeth. So Dr. Pico, it was, we're coming up close to program time, and we have about 5 minutes more to go. What would you like to say in closing?
No, that's just as I say at the beginning, I'm repeating this every day. We need to just take care of ourselves and get dental attention at least twice a year. And if you end up knowing that your oral hygiene is in a very bad condition, then you will need to visit your dentist at least every 3 months for the dentist to take care whatever needs to be done in our patient mouth and so.
Okay.
But actually, also you have to make sure that you are practicing good habits, like a good diet, good brushing habits. Healthy habits in general will make sure that you will have a happy and long life. So, of course, keeping that in mind during this holiday season, and you will enjoy the holidays being healthy and in company with your families and so.
So, all right, let me close off this evening by saying this here, or asking you this here actually. Well, everywhere you go for the holidays and people are getting free stuff, what are you giving away for Christmas? Are you giving, if somebody comes there to do a procedure, are you giving them something? Can they get something?
Actually, yes. Our office is giving for those patients that are doing big procedures. We are giving a bag with some healthcare stuff inside.
Oh, not sweetie.
No. I don't.
Not chocolate, right?
No.
So when if you do certain procedures at the
or if the patient is a kid, we will give a holiday a gift, a Christmas gift.
A Christmas gift for the kids. And if you do certain procedures, you get a bag with healthcare with dental care products.
Dental care products.
I guess that's, you get toothbrush. Are you gonna say what they get, or you want to leave it as a surprise?
Yeah, it's different type of bags.
Different types of bags.
You can get a toothpaste, toothbrush, a mouthwash.
Okay.
Stuff like that. Yes.
Wonderful. So guys, if you want to go down to have a cleaning, or you want to do certain procedures, you want to take your kids. I don't think there is anything for cleaning, but there are different types of cleaning at Innovative Dental Care. You can go down there, or you can call the numbers that are at the bottom of the screen. You can WhatsApp, and you can book an appointment with Dr. Pico and his assistant. Certain procedures that you do, you will have as he said, he's going to give you a bag, not of goodies, but something better than goodies, something really good actually, to help take care of your teeth, and kids will get a little Christmas gift also. So book your appointment, enter the new year with some good oral hygiene and well taken care of. Get a cleaning. How many types of cleaning you have?
4 types of cleaning.
4 types of cleaning. All right.
Different prices for those.
Different price. So I mean, I know you don't give out price. So what's the lowest price? Would you be able to tell me that? Would you want to say that?
No, it's I think that it's prohibited to discuss this type of things in social media.
Okay, so we should. Okay, great. So,
but our prices to suit everybody budget. So.
Okay, great. So you call Dr. Pico or his assistant, or send a WhatsApp message to that number. Again, we want to thank you tonight for joining us. We're coming live from TBN Studios. Again, we're going to be here next week, Wednesday. Again, it's the holiday season, but we're going to be here. We're coming out because we want to let you know that hey, you know what, the holidays has passed, but you still got to get with the program. So let's do that next week, Wednesday at 6:30 again. It's the holiday seasons. We want to encourage you not to drink and drive. If you're going to drink, it's better to have a designated driver or take a taxi. It's rainy, and you know the streets out there, it's a bit crazy right now. I don't know why people are speeding. There have been a number of accidents and deaths and all of that. Slow down, take your time, chill, you know. We don't have to be like this. We're good people, and we need to take things lighter. So again, thank you so much for joining us, and remember to look out for those who are not looking out for you. And we are going to see you here next week. Have a happy holidays. It's Christmas on Sunday, Boxing Day on Monday. But in Guyana here we have Christmas on Sunday, Christmas on Monday, Boxing Day on Monday and Tuesday. So it's quite a few holidays, right? So guys, take it light. Don't drink too much. If you know, have fun though, and happy holidays. Dr. Pico, you want to say happy holidays here?
I want to join to your greetings.
To my greetings. Anybody
for all Guyanese.
And your family in Cuba, they might be watching, would they? You can say something to them in Spanish, you know. That's fine.
No, it's okay. It's okay.
Yeah.
It's okay. It's okay.
All right. So
Happy
guys.
holidays to everybody then.
Yeah. So thanks for joining us, and ciao.